Coming to you from the Villanova Health Summit, focusing on innovation and technology impacting patient care. This is ReachMD. I'm Dr. Matt Birnholz. I'm joined by Jeanne Vanella. She's the Chief Nursing Officer for Bernoulli, which I believe was originally Nuvon Inc., and
Correct.
then now it's a Bernoulli. Is that correct?
That's right.
And she's also on the adjunct faculty for the doctoral program at Villanova University. So Jeanne, welcome to you.
Thank you. It's a pleasure to be here.
Great to have you with us.
Absolutely.
So we're here at this panel. The subject of this particular panel is all about innovation technology. Very ambitious. But you yourself come from a unique background that required both.
Right.
Being in the nursing background, did you receive your background is in nursing?
Correct.
You're on the faculty now. Doctoral program in nursing?
Yes.
Is that right?
Yes, absolutely.
Obviously, that was striking out new territories in and of itself, so it requires some innovation.
Right.
Tell me a little bit about your background.
Sure. So I'm kind of a lifelong learner. So undergrad at Villanova, and then I could never find a advanced degree that interested me in my field. So I set on operational effectiveness and organizational dynamics, because in healthcare, it's a dynamic environment. So I went that route, and then 2012 completed my doctorate in nursing with an emphasis on improving processes in emergency departments, which is my specialty for 35 years. And then I was given an opportunity to work in the health IT world, where I took that opportunity because what I saw is IT did not enhance or make nurses work more efficient, and if I could contribute to improving that to a larger audience and make an impact, just like the speaker said today, just impacting lots of people instead of a small number, I jumped at the opportunity to do that. And so now my company works on a platform of real-time data, device connectivity, analytics, and algorithms, improving healthcare reactively rather than proactive, or reacting and proacting to find the patients that are sicker in the hospital before they're actually at risk.
Before they're at risk.
Right.
I see. And of course, from your vantage point, having a nursing background, the silos between the nursing practitioners and the physician practitioners historically have been rather big.
Right.
And
then add that silo of technology is even worse. So what I've seen and what I'm trying to change is that technology dropped off on the loading dock does not get adapted in the workplace. And nurses don't run to say, oh, let me use this new device. You have to coach, be a change agent, be a cheerleader, and be knowledgeable about the space in order to have that new technology adapted and adopted by staff, or it's not going to be effective. And so my role as Chief Nursing Officer is our team goes in and helps clients understand how we look at their current workflow and what we're going to deploy, and then how we can make their workflow better and make it safer for patients, because safety and quality is really behind why you want the analytics and the real-time data.
Right. How would you say, since you probably travel parts of the country and see varying states of both awareness and capability to handle workflow challenges and actually be adept and swift to change, what is the state of healthcare from your experiences around the country? Is it abysmal right now in terms of the ability to adapt to these technological necessities, or are you seeing some good progress?
Well, I think you see the whole spectrum in healthcare. You still see hospitals that have written flow sheets with pen and paper, and then you see the fully actualized university settings that are, really adapted at integrating the best technology. And if you think about consumer technology, what the iPhone and what Samsung has done to our personal lives in a matter of 9, almost 10 years, it's been transformative, and the hospital is way behind that curve. And so what I see is that children's hospitals specifically and the big universities are more willing to take a risk with new technology and add that to their current workflows, and some of the other smaller hospitals with less resources are still kind of struggling with that siloed approach that you talked about, and implementing things takes an army, and they don't all have the resources for that.
And do you think that it's often comes down to the fiscal resources and the lack thereof, or is it a cultural barrier that you're often trying to get over?
Right, I think it's both. So the fiscal is most hospitals, if they're going to make a big budget purchase, they're doing some type of electronic health record. And that is just taking all the revenue. And I mean, it's sucking everything out. And so other things have to suffer. And then if you are able to, with a big deployment like a health record, the coaching part and the change piece is oftentimes missing. And they just assume that people will be happy with this new shiny object, and it really takes a lot more than just plugging it in and saying, have at it.
Well, people oftentimes ascribe the term EHR to workflow. They just say, well, they're lockstep. They're compatible. You get EHR, your workflow is immediately taken care of. But that's clearly not the case.
Clearly. So in an emergency department, when you put in an electronic health record in for triage for what patient's arrival, it used to be I could go through a sheet. I could still tell you what the top 10 things are that you need to get quickly to just really identify who's sick and who's not sick on arrival. And then you go to an electronic, and it's 35 clicks and points, and if you fill in an allergy on the first page, it doesn't transcribe to the third page, and the learning curve is very big, and you have to have someone in your system knowledgeable enough to push back and say, we need a streamlined entry process. We can't have our patients getting all of the regulatory checks and balances in triage on arrival. It can be done during their stay, but not on arrival. But you have to have experienced that to know to push back, because otherwise it's just out of the box and you're kind of stuck with it.
Right.
And then that's why people are not happy.
Right. That all makes sense to me. So before we conclude our talk, given that we're at this panel, that we're talking about ways to try to get around such barriers and make people happier, as you said, on a large scale, which is what brought you into your work.
Right.
What are some suggestions you might have to the people who are at this panel, other panelists, given your vantage point as Chief Nursing Officer? What would you recommend?
Well, I think what we heard clearly from the speakers is volunteer for something outside your safe zone. So, when I was practicing, and I practiced at Children's Hospital for a very long time, an opportunity would come up with something way out of emergency nursing, and I thought, well, I'm studying organizational dynamics. I should see how this organization works in other kind of business sectors. And I'd volunteer, and then you just get exposed. And then you can kind of see if you like it or not. And then you're not locked in. It's not a life sentence. It's a small maybe committee in the beginning. And so that's how I found different opportunities that made me really excited about specifically hospital operations and how throughput and efficiency impacts the emergency department, but it impacts the surgical center and impacts the day hospitals where all patients are converging to come in. You've got to have a process to get them in. So I would volunteer for things to just get exposed to it.
Well, that's great. Well, with that parting thought, I want to thank my guest, Jeanne Vanella. She's the Chief Nursing Officer at Bernoulli, Inc. And we've been talking about innovation and technology at the Villanova Health Summit. Jeanne, it's been great to have you with us.
My pleasure. Thank you for having me. It's great.
Thank you. For access to this and other episodes, visit reachmd.com. We look forward to seeing you there. Thanks again.